When taking blood pressure, you use a sphygmomanometer, which consists of a bladder, which is the part that you inflate. You have the bulb, the valve, and the gauge. And then you also use a stethoscope, which consists of the diaphragm, the bell, you have the tubing, then you have the ear tubes and the ear tips. And when you place it in your ears, you want the ear tips facing forwards towards your nose so that it fits into your ear canal. And then there's two commonly used sphygmomanometers. You have the aneroid sphygmomanometer, which is missing the cuff, and you have a mercury sphygmomanometer, which is less commonly used because it contains mercury.
When taking blood pressure, you want to ensure you have the right cuff size to accurately determine blood pressure. This is where this size chart comes into play. It goes all the way from infant to even your thigh, and those numbers are what determines which cuff you use. With overcuffing, that's where the cuff is too big and it's going to show false low readings. With undercuffing, that's when the blood pressure cuff is too small and it's going to show overestimated blood pressures.
It's important to know your blood pressure readings because blood pressure is known as a silent killer, so it's good to be aware of your normal numbers so that you can manage any conditions or changes. The normal blood pressure is 120/80, and then the prehypertensive phase would be 120 to 139/80 to 89, and then you have stage 1 hypertension is 140 to 159/90 to 99, and then you have stage 2 is 160 or greater over 100 or greater.
This is an example of a blood pressure being taken. You're going to want the patient to have their feet firmly on the ground, not crossed, their arm to be relaxed on a table, and their back to be against the chair. And they're also going to not want to talk during this. So you put the blood pressure cuff around the arm, and you want to make sure that it's not overcuffed or undercuffed. And you're going to put it over the brachial artery, and the artery, there's usually a artery mark on the cuff right there. And then so that's done, and you'll take the blood pressure.
So you're placing the diaphragm over my brachial artery.
Yes. So her blood pressure was 128/76. The top number of the blood pressure is when you first hear, it's the systolic blood pressure, and when you first hear the turbulent sound of the blood flow, that is your first number. So 128 was her first number. The bottom number is the last sound you hear of turbulent blood flow, and that will be your diastolic number.
When taking blood pressure, the units that you use are millimeters of mercury. And when you're pumping up the cuff, you want to pump it up 20 to 30 millimeters of mercury above what you anticipate the patient's blood pressure to be. And then you want to release the pressure 2 to 3 millimeters of mercury per second.
And the Krafft-Cox sounds are it's the sound of the turbulent blood flowing through the artery. So the first sound that you hear is going to be the phase 1, where you hear the tapping sound, and the first tap you hear is the blood not bursting through, but flowing through, and then the diastolic is the last sound that you hear, and then there's silence.
Systolic blood pressure represents how much pressure your blood is exerting on your artery walls while your heart's pumping, and then your diastolic reading is showing how much pressure is on your artery walls in between heartbeats while your heart is resting.
There is such thing called white coat hypertension, which is where the patient's blood pressure is going to be higher in the doctor's office. And then there's also masked hypertension, where the patient's blood pressure is normal in the doctor's office but high at home.
And then just to finish it off and to mention, you have hypotension, which is low blood pressure, and that's a systolic reading of less than 90 millimeters mercury over a diastolic reading of less than 60 millimeters of mercury.